Dr. Steve Bjorn here from Core Rehab. We had someone request a video about carpal tunnel syndrome, so I want to give you a little overview about carpal tunnel syndrome and what it is and what we can do for it. So, carpal tunnel syndrome is basically an entrapment of the nerve and artery that travels through this little space called your carpal tunnel. So there's this bony arch, there's bones coming around the wrist here, and then there's a tendon, or ligament technically, goes across that bony arch, and it creates a little tunnel for the nerve, the artery, the tendons that move your fingers to go through. So the muscles that move most of your fingers are down in your forearm, and they turn into tendon. Tendon connects muscle to bone. Turn into tendons that go through that arch, and then when you contract your muscle here, it moves your fingers up here. So when that space gets full of fluid, it's inflamed, then it creates pressure and it starts to pinch off on your nerve, and then you get tingling, numbness, and pain into your hand. So if it is addressed early on, it can be treated almost 100% of the time without having to have things like surgery. Surgery is necessary to cut that ligament and create more space when it's gone on so long that there's more severe damage to everything. You start getting weakness, you start getting permanent tingling or numbness in the hand. Those things, and it goes on for a very long time, those things can potentially lead to the point where you have to have surgery. But why is there inflammation in there in the first place? Well, it's usually from some very repetitive activity, some sort of chronic gripping, or using a computer, mouse, keyboard, and not having the right flexibility, strength, endurance, and positioning, so that it's creating irritation. And when we get irritation, then that creates inflammation. That inflammation will close down that space and pinch on that nerve. So as soon as somebody starts to have symptoms, if they address that right away, almost 100% of the time, it can be taken care of with good quality therapy, because we figure out how we can address that inflammation and get rid of it. So lots of times it's from dysfunction in the muscles in the forearm, the back of the forearm being weak, the front of the forearm being weak, the front of the forearm being very tight. And if those muscles aren't working right, then that's going to create a problem, friction down here in the pulley, where it contracts and moves your hand and your fingers. So by doing deep tissue work, trigger point needling, cupping, deep stretching of that area, we can loosen that up. And that's usually enough in most cases. Sometimes you do need to follow that up the chain all the way to the neck. So the nervous tissue, the nerves are continuous tissue from our brain through the neck, all the way down through the shoulder, under your arm, under your pec muscle, through the armpit here, and come all the way down to your fingers. And since that nerve is continuous tissue, if there's a little bit of entrapment elsewhere as well, it's going to make it much more likely to develop those carpal tunnel syndrome symptoms into your hand. So if the head's a little forward while you're sitting at the computer, if the shoulders are a little forward, there's a thing called upper cross syndrome or thoracic outlet syndrome that are both commonly associated with that carpal tunnel syndrome. Is that forward shoulder positioning, very tight pecs, very weak upper back, very forward head. Those things create more and more compression on that nervous tissue. So also working on the neck, the chest, the upper back to position there, learning how to correct posture and get your arms supported to where there's no tension through that nervous system, through those muscles as you work with computer. I'm just saying computer because that's the most common thing, but there's plenty of other repetitive activities that can lead to it. But postural positioning, changing what you're doing and how you're doing it, changing the structure and function of the muscles that travel through that carpal tunnel will eliminate that inflammation and stop you from progressing down the path towards surgery. So if you're having pain in the hand, numbness, tingling in the hand, if it's intermittent right now, which means it's just happening some of the time, now is the time to address it, because if you address it now, it's almost guaranteed you can put off, or not put off, but prevent having to have surgery. If you wait until it becomes constant, you have full-blown weakness, and it's almost always there. Sometimes you've gone too far and you have to have a surgical intervention to improve that. But carpal tunnel is super treatable, especially if it's early on, and it usually isn't about treating the wrist, it's about treating what's going on up and down that chain to create inflammation in the wrist. And then we stop that inflammation in the wrist, then that tunnel doesn't have all that pressure of fluid buildup, and it's not pinching off that nerve. So if you have any questions about it, please contact us, because it can be reversed very, very likely in almost all situations, unless it's been going on for way too long. So that's a little review about carpal tunnel syndrome. Any questions, contact us. Thanks for watching.